Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, and we are going to talk about DVT or deep venous thrombosis and pulmonary embolus or PE as it is usually called. You might have seen some advertisements for some blood thinners or something like that. Let us learn a little bit about DVT and pulmonary embolus. I am a cardiologist. I have been in practice for more than 30 plus years, and I have seen a number of patients with DVT and pulmonary embolus. So let us begin. What is DVT and what is pulmonary embolus? How do we recognize them? How do we treat them? And how do we prevent them from happening again? Okay, a little bit about DVT and pulmonary embolus. DVT, as I said, simply stands for deep venous thrombosis. When we talk about deep venous thrombosis, we are mostly referring to the blood clot formation in the deep veins running in the leg. As you can see, here is a vein which has some valves which keep the blood from falling down, and sometimes there can be a clot formation in the veins that can later on give rise to symptoms, or it can go parts of the body. The clot is formed by the aggregation of platelets, red blood cells, fibrin, and other materials. And this clot can propagate all the way to the main veins in the abdomen, and later on it can traverse to the inferior vena cava, as you can see here. And when this blood clots gets into the right side of the heart and goes into the main pulmonary artery, that is known as the pulmonary embolus, or a blood clot in the pulmonary artery. So deep venous thrombosis and pulmonary embolism are just a continuing spectrum of blood clot formation on the venous side of the cardiovascular system. They are a continuum of the same problem, and hence an approach to a patient with a deep venous thrombosis and pulmonary embolus are almost identical. However, pulmonary embolus can be a life-threatening situation, and hence it needs to be dealt with acute medical emergency. What are the things that cause clot formation in the legs which can go to the lungs? Here are some of the most frequently accounted causes for development of deep venous thrombosis. Prolonged bed rest leads to venous stasis. That means the blood flow in the veins is decreased, which leads to clot formation. See a similar situation in post-operative state when patients are on prolonged bed rest. That can lead to blood clot formation in the legs. That is why in a hospital setup we take very aggressive steps to mobilize these patients as soon as possible, use elastic stockings, and of course use blood thinners if a prolonged bed rest is expected. And women who are taking birth control pills have also been seen to be at increased risk for development of deep venous thrombosis and sometimes big pulmonary emboli. Trauma also can lead to damage to the veins, which can initiate a blood clot formation, which can then move on into the main venous system and eventually end up in the lung. There are some people who may have coagulation problems where their blood is hypercoagulable. That means their blood can clot very easily. That can lead to clot formation in the veins, which can go to the lungs. Similarly, patients who are obese, patients with heart failure, who have reduced circulation can develop deep venous thrombosis. And there is a family history of deep venous thrombosis and pulmonary embolism. So if you have any one of these risk factors, it is exceedingly important for you to seek medical advice and get prompt preventative care which can save your life. And that is especially so if you are a high risk candidate for pulmonary embolus, or if you have a history of pulmonary embolus in the past. What kind of symptoms do we see with patients presenting with DVT or pulmonary embolus? The DVT sometimes can be very mild, and the only thing you may feel may be some pain, some swelling or redness due to some mild inflammation of the skin. But nonetheless, whenever you feel something unusual in your legs, especially the calf area, you need to seek medical attention because it could be the starting of a deep venous thrombosis. Whereas pulmonary embolus, the symptoms are going to be pretty dramatic. They may present with severe chest pain, which can mimic a heart attack, or they may present with shortness of breath, palpitations, weakness, dizziness, and some people may even faint because of massive pulmonary embolus, which can cause severe pain and reduce cardiac output. And some people may even cough up blood because of the blood entering the airways. Next question is, how do we diagnose DVT or pulmonary embolus? The most commonly done blood test is D-dimer, which is generally elevated in patients with deep venous thrombosis, or especially in patients with pulmonary embolus. Ultrasound is an excellent screening test to look for any evidence of blood clots in the veins, and more importantly, look for clots in some of the main veins. And the way we find out is, generally we should be able to compress the vein. If you are unable to compress the vein, that's an indication that there is some hard material sitting inside the vein, which in most cases is a deep venous thrombus. Venography is occasionally done. This is more so in patients with chronic symptoms for whom we are not able to ascertain as to what their actual diagnosis is. A venography may be helpful. But for patients with pulmonary embolus, the most definitive test is, of course, CT angiography. And if people are allergic to the contrast, maybe an MR angiogram might be useful in diagnosing and pinpointing, because time is of the essence in patients with acute pulmonary embolus. Pulmonary embolus, if left untreated, has pretty high morbidity and mortality. Let's look at, here is a CAT scan done in the emergency room of a patient with a chest pain, and as you can see here, we see a filling defect. This filling defect is caused by a blood clot which is inside the artery, and this is a definitive diagnostic evidence of pulmonary embolus by CT angiography. And similarly, we have a couple of other examples where the pulmonary artery is totally blocked off by a blood clot here, and we have a long streak of what is called a saddle embolus, which is extending into both the left and the right pulmonary branches. So this is all diagnostic of a pulmonary embolus, and as soon as we diagnose, we need to move on to the treatment. Let's talk about treatment. Treatment for DVT and pulmonary emboli are almost identical. We use blood thinners. In an acute situation, we use what is known as Lovenox, and we keep the blood thin. And in some cases where we can recognize a major blood clot, we may be able to use a clot buster such as urokinase or TPA, which helps to dissolve an existing clot before the blood thinners take action in preventing any further clot formation. In some patients, if there is evidence for recurrent pulmonary emboli, we may be able to prevent that from happening by putting in a filter in the inferior vena cava. And of course, all those patients with history of deep venous thrombosis or history of pulmonary emboli in the past may benefit from compression stockings. And as I said, they are routinely used in hospital settings when there is a high risk for development of deep venous thrombosis. Now, here is an example of an inferior vena cava filter, which looks like a wire mesh, an inverted basket, and it is passed through the groin vein into the vena cava just below the heart, and the wire mesh is expanded, so it prevents any major clots from going from the legs into the lungs. So those are some of the treatment options that are available. Now let's move on to prevention. That is, what is your role in dealing with DVT and pulmonary emboli? It is exceedingly important for you. If you have been diagnosed to have a DVT or a pulmonary embolus, to have regular medical follow-ups, because you need to be on blood thinners, and the blood thinners need to be monitored in many cases. However, some of the more recent drugs does not need blood thinning status monitoring, but you need to know when to stop the medications. Do not ever stop the blood thinner without the advice of your medical experts. And you also need to watch diet, especially green vegetable diets are high in vitamin K, and they can interfere with the coagulation mechanism, especially of a blood thinner known as warfarin or coumadin, or commonly known as rat poison. Another important thing that you need to keep in mind is that you need to avoid prolonged bed rest or prolonged rest. Think about air travel. If you're traveling for 24 hours, then you have to find a mechanism to keep your legs exercise. Even while you're sitting in your chair, you should be able to exercise your ankles and thighs to keep the blood flowing. If you're overweight, reducing the weight will definitely help you, and exercise will keep this blood circulating in a normal fashion, and that prevents blood clot formation. Hopefully this has been useful to you, ladies and gentlemen. I am Dr. NIK NIKAM. This presentation has been brought to you by NNN Media, and please do like our Facebook page. We also have a social media page which is NNN Media. We would like you to visit our page and like it. If you would like to learn more about any other cardiovascular topics, please do leave some comments below. And until next time, I am Dr. NIK NIKAM for NNN Media. Have a wonderful day. Thank you so much for watching.